All right. Good evening, everyone. Thank you so much for your patience. Cool. Good evening, everyone, and welcome to the latest of our Vitality Home Series free webinars, where we bring in Vitality right into your home. And the gyms are back, if you didn't know. And we're here this evening to share the latest and the greatest club updates, and of course, how the gyms have transformed their workout spaces to keep everyone as safe as possible. So today's topic is then aptly titled, Working Out Again, How to Work Out Safely at Gym. This evening, I'll be chatting to Professor John Patricius from the Wits Faculty of Health Sciences, Virgin Active's Managing Director, Mark Field, Planet Fitness Managing Director, Meneer de Wet, and of course, our Head of Vitality Wellness, Dr. Masima Mabunda, about the rewards and the exciting changes that you can expect when going back to gym. Plus, of course, some precautions you can take to ensure that you're as safe as possible when training. And for added motivation, well, as if you needed it, Vitality, Planet Fitness, and Virgin Active have launched an amazing special offer where you can gym now and only pay in 2022. You heard me right. From October to December this year, Vitality members, I'm assuming that's you, that sign up to Planet Fitness or Virgin Active can skip all the gym fees for the rest of 2021, plus no gym activation fee. And when your fees kick in January 2022, you'll continue to enjoy up to 75% savings on your monthly gym premiums. I mean, it's a real no-brainer if you ask me. And if I wasn't with you right now, I'd be at my closest club signing up again. Stay tuned for our whole webinar tonight, because 5 lucky viewers are going to be lunging, spinning, and push-upping their way to some awesome spot prizes that are going to really help you gear up for your summer workouts. Don't forget, guys, to pop all of your questions into the Q&A, into the chat box at the bottom, because we're going to have a live Q&A at the end, so don't go anywhere. And just a reminder, if we do run out of time and don't get to all your questions, don't panic, because we'll put all the answers on our social media pages after the webinar. So without further ado, excuse me, let's kick it off. Professor John Patricius has been in sports medicine practice for over 25 years. He is a professor of sports and exercise at the Wits Faculty of Health Sciences and the director of Wits Sport and Health, among many accolades, which we don't have time to go through all of them tonight. So yeah, welcome, Prof, and thank you so much for joining us again. We're really happy to have you with us. Take it away.
Good evening. Thanks very much for the invitation. These forums are really so useful in terms of knowledge translation and transfer, and trying to get information across to a broader audience. So we really appreciate this. And my brief tonight really in terms of this topic is to try and highlight some of the science behind why we want to exercise, and then look at the last 2 years through this turmoil that we've been through, and see what's been investigated in terms of how we can make exercise environments and health clubs, gyms in particular, much safer, so that we can encourage people to exercise. So I'm going to put up a presentation, and if you'll allow me to share my screen, then we will, let's do that. Here we go. Right, you should all be able to see that, hopefully.
100%.
Great. So we're really going to talk about what we've learned from this lockdown period in terms of how we can still encourage people to increase their levels of activity, which is obviously one of the prime aims of the Vitality program. So if we look at exercise in particular, and we look at the benefits of exercise, then we see that there are significant benefits to exercising. And what I'm going to really talk to today is emphasizing that physical activity protects against non-communicable diseases. In other words, we know that exercise helps you against a range of conditions such as high blood pressure, diabetes, cardiac disease, and even things like cancers. But what we're appreciating more in this environment is that physical activity now protects you against communicable diseases as well, viral infections. And that's really a key take-home message. So in this environment, we really should be encouraging exercise. What's happened in lockdown, and we're going to show the statistics, is that it's resulted in far fewer South Africans exercising, unfortunately. What's also been interesting in terms of the research conducted is that South Africans like going to gym. It's probably their favorite form of exercise if they have a choice, certainly amongst Vitality members. So closing down gyms from lockdown levels 5 to 3 was significantly detrimental for that cohort. And really what we've had to do is look at what we can do in the gyms to mitigate the transmission of COVID and other viral infections. And we've been successful in that, and we're going to show that. So if we move forward, I want to spend a couple of slides talking about what regular physical activity does for your immune system. And this is very important in terms of a take-home message. We know that exercise, and this has really been research conducted over decades, but in the last 20 years or so, we've really got down to the nitty-gritty. And we found that the physiological effects of exercise, particularly sustained regular exercise, doing it frequently, has what we call a summation effect. So the effect on the immune system is that you get an influx of the good immune cells, the soldiers that fight infection, into the circulation. And the more often you exercise, or more regularly you exercise, obviously within limits, the greater that summation effect. And so you get increased levels of the more important cells, what we call the natural killer cells, which actually target not only the microorganisms that cause disease, but also things like cancer cells. You get an increase in the white blood cell proliferation, and you get a decrease in what we call immunosenescence. And so that means the aging of the immune system. But what we're seeing here at a physiological level is a really powerful escalation in the body's ability to tackle infection. And not only that, those that exercise regularly will keep up this ability to fight infection into old age. And that's critical because remember who the most vulnerable are when it comes to things like COVID-19. We know that exercise is a good immune booster. We've got data from previous viral infections, simple upper respiratory tract infections, sore throats, etc., flu and pneumonia, which show that your levels are decreased, your incidence is decreased if you are a regular exerciser. We know that the adverse effects from the SARS-CoV-2 virus are decreased in this pandemic. So those people that exercise have a lower incidence of adverse effects. In other words, fewer of them get very sick, fewer of them are admitted to hospital, very few of them are admitted to ICU, ventilated, and die. It can happen, obviously, but your risk is much reduced if you exercise regularly. What we also know is those that are most vulnerable, the overweight, the diabetics, the hypertensives, the cardiacs, the elderly, they benefit most actually from exercise interventions. So just because you have a chronic disease or a comorbidity doesn't mean you shouldn't be exercising. In fact, it's exactly the opposite. You should be finding a form of exercise that's suitable and can help you glean these immune benefits. Interestingly, and this is critical to the environment we're in at the moment, the new research is also showing that you get an enhanced response to vaccination if you exercise regularly as well. So we know that vaccination is probably going to be our most effective tool in terms of fighting this pandemic. But we now know, and we know from previous vaccination data, that those people that exercise will have an even better immune enhancement from the vaccination process. So already on those two slides, you've got several reasons why you should be exercising in the face of a pandemic. If we look at the recommendations from the World Health Organization in terms of the amount of exercise, and we apply that in the South African environment, the recommendation is 150 to 300 minutes of moderate intensity exercise. So that's exercise where you sort of able to have a brief conversation with somebody next to you, or 75 to 150 minutes of vigorous intensity exercise where you're really sweating and your heart rate goes up significantly. And that's aerobic exercise, and it really is not that difficult to accomplish that. If you divide that into daily slots of about 45 minutes, 30 minutes if it's more intense, 5 times a week or so, it's going to get you there. Interestingly, increasingly, we now know that resistance training is being shown to be equally beneficial. It was always thought to be the aerobic component, but there's some good data now which show that resistance training, the type of thing you might do in the gym, and obviously you can combine them in terms of circuit type training where you get both the aerobic and the resistance benefit. So these are data and guidelines which are critical to what we should be doing on a daily basis. If we look at the science behind the pandemic itself and behind the fears that we have about exercising and exercising in company and exercising indoors, it's actually not difficult to summarize what we need to know. So we do need to know that the infectious exposures of COVID-19, SARS-CoV-2, the actual virus, to respiratory fluids that carry the virus occurs in 3 principal ways. Inhalation of air that particularly carries the very fine droplets and the aerosol particles that then contain those viruses. Now, the risk of this is greatest within 3 to 6 feet of an infectious source, and particularly where the concentration is in very fine droplets. The larger particles and droplets fall to the ground quite quickly. The second is that the deposition of the virus carried in the exhaled droplets and particles onto exposed mucous membranes, splashing onto your nose and face, etc., and from indirectly, the third point, from touching those mucous membranes with hands that have been soiled by those fluids will result in transmission of those viruses. So if we look at that, we know that the way we can tackle that, and certainly the way that health centers and gyms have strategically attacked this, is through spacing, physical distancing, the wearing of masks, and the discouraging of obviously coughing and sneezing into an open environment, and obviously avoiding touching surfaces and regularly sanitizing. It really is as simple as that. So when you're in an enclosed space with inadequate ventilation or air handling, your risk is greater. When you're increasing your exhalation of respiratory fluid, such as in physical exercise, your risk may be greater. And when you're in an environment where you're exposed over a longer period, your risk will be greater. And that's obviously a concern in an enclosed gym environment, but they are certainly not insurmountable issues to tackle. And when we talk about the strategy that gyms around the world have adopted in the last months, we will see that they have quite adequately taken care of these issues. Unfortunately, some of the conversations, some of the messaging has been muddied by some very poor science or communication. And one of those was the issue around masks. And the World Health Organization has done some superb work around communicating issues of the benefits of exercise and exercising during the pandemic. But they didn't communicate well about the issues around masks. The communication was actually not based on science, and it really confused a lot of people. So I'd implore you to ignore that advice and rather look at this advice, which interestingly came from a South African group, which really showed you that there is a place for wearing masks whenever possible. And obviously, when you're exercising intensely, then the wearing of a mask may not be practical and actually may not be healthy for you either. But then you take into account those increased protections of further physical distancing, etc., and you can still exercise quite safely. But ideally, when in any social environment, when entering into a gym, when in a change room environment, and when exercising at low to moderate intensities, one should use some form of facial covering to try and prevent the spread of those droplets. So I think that we're going to hear a little bit more about the hard data from Masima a bit later. But we know that there was a significant drop-off in Vitality members attending gym and in exercising generally. And we also know the data showing us that those members who were not that committed, who were sporadic exercisers, dropped off quite quickly. Whereas those who exercised more regularly and those that interestingly had a heart rate device, they improved their attendance or they maintained their attendance more. The effects of lockdown were actually catastrophic from an exercise point of view. We had fewer exercising people when actually their immune system demanded it the most. So most people became unhealthy during lockdown. There has subsequently been a degree of fear around gym attendance, and so there's been an incomplete recovery. There's been a significant improvement, but still an incomplete recovery in gym attendance. And we need to address that because, remember, we said at the beginning that attendance at gyms was South African Vitality members' preferred form of exercise. And so we certainly need to look at addressing that. And we can look to some research that has been done internationally in a very, very broad sense, a very thorough sense, in a number of European gyms in this study called the Think Active study by Europe Active Research Center. And this has been supported by a number of international universities and research institutes. And what they've surveyed is 4,360 health clubs in 14 different countries. They analyzed 115 million gym visits in 25 weeks over the period of the pandemic. And what they found that out of 115 million gym visits, the COVID-19 infection rate was 1.12 per 100,000 visits, which is it's literally next to nothing. And that is obviously as a result of appropriate screening, sanitizing, spacing in larger clubs, etc. So taking the normal precautions, the incidence of COVID-19 infection or transmission is really very minimal. Actually far less than you would get in a normal situation with colds and flus, etc. Their summary is really the data in their report demonstrated that the health sector's fitness and exercise facilities are extremely safe when the appropriate interventions are taken around COVID-19, and that the sector is both able and ready during this pandemic and post-COVID-19. Remember, we're going to have to take some of these precautions further with us beyond this era to ensure safe exercise environments, providing that essential health and well-being to literally tens of millions of people, bearing in mind that exercise is so important when we're trying to fight this disease. I'm going to go back a little bit to resistance training because this is an emerging area of science, and increasingly we're seeing the benefits of resistance training from a health point of view. What I mean by that is all the normal benefits that have been attributed to aerobic training in the past, which we all know about, are now being seen in regular resistance training as well. So many of those problems that have been countered by exercise in the past, decreased mortality and mobility associated with chronic diseases like hypertension, diabetes, cardiac disease, and obesity, are now being seen as being almost equally well countered by resistance training. And there are now good strategies in place to alter our forms of resistance training in a gym environment to be able to glean those benefits in a safe environment. Right at the beginning of lockdown, a group of us from WITS were extremely concerned about the total lockdown and shutdown of health facilities and exercise opportunities. And we actually wrote this editorial published in the South African Journal of Sports Medicine, imploring the government to allow exercise to take place despite the hard lockdown, because we knew that it was the one intervention that every South African had accessible to her or him to allow them to boost their immune system. And in fact, exactly the opposite occurred. We were locked in our houses, we weren't allowed out, the health facilities were closed, and as a result, we had this spike in infections and we had actually a less healthy population, which is what we didn't need. And so it's a lesson that we need to learn from this and take forward, that no matter what we try and do to prevent the spread of an illness, we must not allow exercise to be inhibited. We must facilitate exercise in the face of a pandemic. So I'll conclude by saying that exercise is beneficial in many ways, including the prevention and mitigation of infectious disease. South Africans like going to gym. It is a favored form of exercise. And if they like doing that, we need to facilitate it. They like doing it because they get benefits from aerobic and resistance training. We know there are risks to exercising indoors in proximity to others, but we also know that we can effectively mitigate those risks. And the lessons learned from the last 18 to 20 months must be carried forward in every way to make for safer gym environments. And I'm very looking forward to hearing what the industry says, because I know they've learned hard lessons and those are going to be carried forward to the benefit of everybody. So thank you very much for your attention. I'm very happy to take questions at any time during the seminar.
Awesome. Thanks so much for that, John. It was like really, really insightful. Yeah, I mean, I'm sure the people that don't like cardio are really happy to hear that resistance training has such a positive effect on the immune response. And I'm super stoked to hear the enhanced effects on the vaccination. That's really insightful. Well, I'm going to hold questions until the end at the Q&A, if that's okay. And yeah, thanks, Prof. Thanks so much again. Great. So Discovery Vitality's Head of Wellness, Dr. Mosima Mabunda, will now share the latest updates from Vitality on gym benefits, plus the benefits of exercising and fighting infectious diseases and recovery post-COVID, some local and global trends on people going back to gym, and of course, Vitality gym trends. So what we are seeing from our very own Vitality members. Mosima, over to you.
Good evening, Jay, and thank you everyone for joining us this evening. Jay, can I ask for the slides to be put up? Or should I put them up on my side?
If you have them open there, Sufiso. There we go.
Perfect.
Cool.
Can you move on to the next slide? And the next one, Jay. I think we all know by now that we're not moving as much as we should. The statistics on this page are actually quite staggering. 1 out of 4 adults across the globe are not as active as they should be. In South Africa, that is close to 40% of us that are not moving as much as we should. Next slide. We know, and Prof. Patricios has mentioned the benefits of physical activity. We know the harms of being inactive, and we know the benefits of exercising. For example, we know with the statistics that physical inactivity is responsible for 9% of premature deaths across the globe. That is a lot. We also equally know, as I can share this example from Vitality's database, that the benefits of exercise are immense. If you look at the graph on the right-hand side, that someone who was previously inactive, as soon as they start exercising, as much as just 1 day a week, you start to see a significant reduction in risk. We have also continued to see significant benefits of engaging in Vitality, where those members that are engaged in Vitality have seen a substantially lower mortality from COVID-19, as you can see from the staggering statistics. Again, underscoring some of the points that Prof. Patricios was mentioning earlier about the benefits of exercising. Many of us know that lockdown restrictions, which were necessary, had an effect on how we exercise. You can see on this graph that when we were in hard lockdown, when it was not possible for us to access some of the spaces within which we used to exercise, that many of us, and this is Vitality members, and this is not just isolated to Vitality, it was across the globe, could not exercise as often or as much as we could. And a bigger driver there, apart from the fear of being in the pandemic, was that some of these places were not accessible. But what I like about what this graph shows is as the lockdown levels start to ease, you start to see that people are going back to their exercise habits. And another element that I quite like about this graph is we've seen that those members that train using their wearable, their fitness devices, have been able to sustain their physical activity throughout, despite the challenges that lockdown restrictions presented. We've recently moved to adjusted lockdown level 1. And what that means really is it is now possible for spaces to accommodate a lot more people than they could. And it just also means that there's a lot more mobility than we've had previously. Now, how does that translate to our gyms and how people earn physical activity? What that means now is our gyms can accommodate a lot more people. Gyms are now more accessible than they were before. You will start to see that park runs and my runs are now a lot more accessible, and that the running and cycling race events that we've been so much deprived of are starting to come back. Now, for Vitality members, what I absolutely love about Vitality is our members can exercise in a way that suits their personal preferences, right? You can exercise in the gym. And if you take up the gym benefit, you get up to 75% off your gym fee. And if you're a Discovery Bank member, that can go up to 100%. You can also opt to exercise anywhere in our Vitality-enabled fitness facilities. So really the option is yours. John touched on this a little bit on how gyms continue to remain relevant, and we've seen that within Vitality. We've recorded over 10 million gym visits and over 50,000 new gym members. So if anyone had doubts about whether gyms are relevant or not, I mean, I think this stats should reassure you. I mean, I like one of the lines in John's slide where he says, South Africans love gym. And I think these numbers are just a testament to that fact. What I would like for you to take away from this slide is members are returning to gyms. If you just zone in on the middle bar graph, you'll see that there is no blue or green, which indicate or stand for members that log their fitness points going to gym. And you look to the right that as gyms reopen, people are starting to go back to gym, and we measure that by seeing where people log their fitness points. So people are logging their fitness points now by going to gym, which is a reassuring trend, and it supports the previous stats where we showed that people are earning their fitness points through our gyms. And we've also equally seen that those members that use gyms are logging visits as frequently as they did before COVID. So people love gyms, people are going back to gyms, and people are starting to go back at frequencies that they used to before the pandemic. Now, as gyms were closing down, restricting people, etc., because of those restrictions in the pandemic, they have not stopped to innovate. In South Africa and across the globe, what we're seeing is gyms have remained relevant throughout the pandemic. We now know the concept of hybrid gyms is now a household name. We know that gyms not only have physical infrastructure, but they've got means for their members to actually access workouts online. We know there's a concept across the globe up on pay as you gym, and I'm not going to spend too much about it, but if you tuned into the Vitality launch, you would have also known that we're also introducing that benefit where essentially pay as you gym gives flexibility in terms of how you want to access gyms. And the social community, we find in that part of what people love about gyms is the community. And gyms have innovated despite the lockdown restrictions to try and keep that community spirit alive. And research supports what I've been saying and a bit of what John has touched on. People have missed going to the gyms. A report by McKinsey & Company, I'll just share just one key insight that stood out for me, is that 70% of fitness consumers report missing their gyms as much as they miss family and friends. I'm going to leave that one there. But I mean, this report, for me, this insight was just quite powerful in terms of how people see gyms. They're not only spaces where you exercise, but it's a community. It's spaces where you connect with people like you, people that have actually become family. And another report that actually supports that view that gyms remain relevant is that those consumers that are active, they still see fitness clubs as their go-to hub. Gyms are still seen as the place to be in part of one's fitness routine. And just to pause on this slide just a bit is all of these things that we're saying, all of these trends that we're sharing, and all of this optimism has been made possible by vaccines. I think we can sit here and say hand on heart that if we didn't have the vaccines in the time that we did and didn't roll them out in the pace that we did and we are, we would not be where we are today, and we would not be saying what we're saying today. And you can tell that the more people know that people are vaccinated, the more people are willing to go to gym, as this survey is trying to allude to. So please go and vaccinate if you're yet to vaccinate. So if you're a Vitality member on this webinar and you don't have a gym benefit, you can actually gym on us for the rest of the year. Jay mentioned this earlier in the webinar. You will exercise for free at a Virgin Active Planet Fitness for the rest of the year, no activation fee, no monthly fee. You will start getting onto your premium next year. And if you recall my earlier slide, you will reap up to 75% off from your gym membership fee. So I encourage you to take this brilliant offer up. Thank you very much. Thanks, Jay.
Awesome. Thank you so much, Masima, for that very, amazing and inspiring insights. Feel quite motivated and optimistic. Cool. So next up, I'm chatting to the Managing Director of Virgin Active, Mark Field, and the Managing Director of Planet Fitness, Meneer de Wet. Welcome, guys. It is awesome to have you with us here tonight. So you can unmute and cameras on. Thank you so much for joining us. Mark, maybe we can kickstart with you. What measures has Virgin Active put in place to keep your members safe?
Thanks, Jay. The measures are quite broad, but I think to sort of summarize them, we've put them into a few key buckets. The first is screening, so making sure that whoever's getting into the gym, coming to the gym, doesn't have a high temperature and is not displaying any of the symptoms. So that will happen on entry. Tracking is important in the event that it does take place, and as opposed to most retail spaces or leisure spaces. The good thing about gyms is we know who's coming when, who else was in the gym at the same time. We know how to get hold of the people. Within the gym is obviously we break it down into three key buckets: of social distancing, so making sure that in low intensity areas people are 1.5 meters apart, and then in high intensity areas at least 2 meters spacing. So we have spaced the equipment out to match that. There's clearly sort of spaced floor markers so people know where they can and cannot stand. The next bucket is hygiene. So it's critical that we have sanitizers and disinfectants and paper towels available for members to use and to wipe down and clean equipment with. From our own perspective, we've got additional, more regular cleaning taking place. So in addition to what members may do, making sure that our staff are constantly cleaning equipment, any sort of high touch points. The things, from a mask perspective, members are asked to wear masks when they're not training, when they are undergoing high intensity training. Obviously the members can remove the masks, but important when one's going to change them or in the F&B area that masks are worn just to protect themselves and other members. And we don't allow cloth towels in the gym. We provide the paper towels because the cloth towels can themselves transmit the virus. And the final sort of key point there is ventilation. The good thing about large clubs like ours and Planet Fitness is that we've got larger volumes, very sophisticated, powerful air conditioning systems that can turn which we've turned up to the maximum, so they can do an air change every 3 minutes at maximum. There are air filters in place which are replaced regularly. So I think the ventilation systems make a huge difference to the large gyms compared to the smaller gyms. In fact, going back to the research that John was referring to, the infection rates per 100,000 people for the gyms was less than 1. But when you looked at within that report, the smaller clubs are less than 500 square meters, the infection rate was 10 times that. And that's part of that is just air conditioning and space that allows us sort of social distancing and air circulation. So there's a lot there, and I think people can look on our website and it will give us a whole sort of all the details in terms of what's in the clubs. But the protocols that we're applying here in South Africa, that both Virgin Active and Planet Fitness are applying, are consistent. In fact, they are based on international norms. So when we look at the research that John did, the protocols in the clubs in Europe, and there's 14 different countries, are consistent with what we have here in South Africa.
Awesome. Thank you. Thanks for that, Mark. And Meneer, what additional measures has Planet Fitness put in place to ensure member safety?
Yes, as Mark mentioned, I think we spent quite a lot of time during those 5 months really, looking at how we educate our staff and what measures we can put in place. I think the biggest one, again, to reiterate, was really around the layout of the clubs themselves and making sure that there's adequate spacing between the equipment. A big thing for us was really ensuring that not only educating the staff, but also putting the members in a position where they can actually assist themselves and managing their health protocol. So we've got basically a sanitizer on every single piece of equipment in their gym. So, you won't have to walk far in order to get that. Clean it yourself, clean it when you leave. We've got drop zones that we also employed additional staff. So once you're done with your equipment or your dumbbells or your barbells where you are touching something, to take it, drop it there, our staff clean it, and we actually replace it. So, over what Mark really mentioned, we've got about 39 pages that government has put in place in conjunction with us to ensure that our members and our staff remain safe.
Awesome. Thank you for that. And I mean, let's stay with you, Meneer. What other options do you have for members that maybe at this time still don't feel comfortable either training indoors, but still want to come back to gym and train with people and get that sense of community?
We've relooked some of the classes that we actually bring in. I mean, ourselves and VA, we have got outdoor areas. So we're starting to use quite a lot of that for people that don't want to be in the club or specifically in a confined environment like a group X studio. So taking a lot of those classes outside into the air, if the weather permitting, but luckily for, up until now, we've had good weather. And using our running tracks or areas that are very open in order to bring some of those classes. So over and above that, we've got, for people that want to stay at home, we do offer the live streaming, so people can go onto the website and stream from home and keep themselves active. Recently, we're also now launching our Planet Live, where we've partnered with an international group, and members will have access to over 1,000 on-demand classes that they can do. They can also join a live class. There will be live schedules that they can jump onto. So I think from a gym point of view, we're trying to accommodate and make sure that for every single member, and even those that are not comfortable in coming back yet, we can keep them active and we can keep them training.
Great. And Mark, from your side, do you guys have any alternative options for those members that really want to gym with you, but a bit nervous to return to a shared space?
Yeah, I think similar to Planet Fitness, we do look to push classes outdoors where we can, and some of our clubs have got good outdoor spaces. And then likewise, we've launched we have a dedicated studio which is offering 5 or 6 live classes a day. Plus, we've got a library of about 400 and growing of on-demand programming if people want to do things at home or outdoors. But I think, for us, the focus at the moment is, the gyms are safe, and we want to sort of get people back into the gyms because that's where the community and that's where the fun is, and that's where all the equipment is. So it's reassuring people that the gyms are indeed safe.
Cool. Yeah, absolutely. And I mean, that's it in terms of the questions I have. Is there anything else that you wanted to, use this platform to add in terms of what else Virgin Active and Planet Fitness are doing differently, or anything that's exciting new developments that people can look forward to when getting back to your gyms? So Mark, we can stay with you and then go over to Meneer for some closing comments.
Sure. I think, it's more of the good stuff that was there pre-COVID. The great thing about the large gyms is there's a broad range of activities, something for everyone in the gyms. Our kids' facilities are operating. But we've got some exciting programming that's coming through, particularly in the group exercise space. And we launched a new yoga proposition. We've got new Pilates and boxing in the pipeline as well. We've increased the number of classes available and the number of spaces in those classes. And we'll always continue to innovate on an iterative basis. So, we're looking forward to seeing our members and new members indeed back in the club. So I think from our side, a big thank you to Vitality for the offer of no activation fee and rest of the year free. I think it's a fantastic offer, and I hope Vitality customers take great advantage of it.
Yeah, I think from our side as well, I think with that offer, it's time now for those people that stayed at home or decided not to cancel their gym membership or freeze their gym membership. I think summer's coming. The clubs are definitely not at capacity at this point, so there's a nice opportunity for everyone out there now to to get reactivated and get back into the gym and get themselves back into shape before December hits.
And it's just around the corner. Great, thank you guys. Thanks, Mark, and thanks, Munir. You guys have given us a lot to think about, and there's loads of questions that have come through on the Q&A. So I want to leave us with sufficient time to answer all those burning questions, and then of course, don't go anywhere, because we got some awesome prizes that are going to help gear you guys up at home for those summer workouts. So without further ado, I'm gonna go through some of these questions, and I will try my best to direct them to the right person, but please feel free to jump in if you'd like to add. The first question is probably best suited for Mark and Munir. Is there any possibility of the gyms making vaccinations mandatory?
I'm happy to have first crack at that. Look, at this stage, no. I think that would have to be driven by legislation in our view. I mean, certainly we would encourage all members to be vaccinated. But when vaccinated, you are protecting yourself. But we do respect an individual's right of choice. So that's the position we are taking at this point in time.
Yeah, we're currently actually running a promotion, outside for your normal retail customers, where people that are vaccinated will get a discount. So I think rather than use a stick, for us, it's use an incentive and really incentivize people to go out and get vaccinated. And of course, on the staff side, we're quite aggressively working with our staff and ensuring that our staff get themselves vaccinated as well. And I think at this point, we're doing what we need to do in order to get that right.
Great, thanks. Awesome. And this could be for Massimo or Munir and Mark. The rule about wearing masks while working out is the main reason I cancelled my gym membership. Has this rule been relaxed?
No, so the rule stays in place. So what we do is on your high cardiovascular areas, like your cardio decks and your group X studios, spinning studios, we ensure that there's adequate spacing there. So at least, 2 meters, and we limit the amount of people that can go into that specific space. So where their members are allowed not to wear their mask, but in the rest of the club, so if you're in the change rooms, on the free weight areas where you're not doing high intensity training, then we enforce that rule very strictly that you need to wear your mask.
Mark, do you want to add anything to that?
Yeah, ours is consistent, and that's the legislation. So we sing to the same hymn book.
Cool. And Prof, maybe this question is for you. Air conditionings, do they clean the air or do they increase infection rates?
I think the important thing is to have the air circulating outside. You can't have the air circulating indoors. So the air cons, will have an outside vent, and they should push the air, both ways. So they're certainly better to have them than not have any ventilation. But equally important is actually to open doors and open windows to get that free circulating air. So certainly air cons are going to be more positive than negative, but to open up the environment even more beneficial.
Awesome, thanks, Prof. And another one for you is, does not wearing a mask and breathing harder increase my chances of getting COVID while I'm at the gym?
Well, it's not your breathing, it's the other person's breathing. If they're infected and they're in close proximity to you. So the answer to that is know if the right precautions have been taken, which we've heard have been taken. So if you're in an area where you're exercising intensely and you're breathing hard and you are exchanging droplets, we've heard from the gyms that you're going to be further away from other people than those exercising less intensely.
Right. Okay. And then there's a question that's come through about vaccinations, vaccines. How effective are they? What are the infection, ICU admission, and mortality rates of those who have been vaccinated and those who have not? I'm not sure if Mosima or Prof.
Yeah, I mean, I can answer to that one. All I can say is that if you have been vaccinated fully, you've had your 2 Pfizer jabs or Johnson & Johnson, the chances of you ending up as an admitted patient are significantly decreased. So depending on what vaccine, anything from about 73% to over 90% decreased. Your chances of ending up in ICU are even less than that. Your chances of being ventilated minuscule, and your chances of dying from COVID really, really minimal. So there's no question that the data show that you are significantly protected from adverse effects if you are vaccinated.
Great, thank you. And another one for Mark and Meneer, are the pools and saunas open, and when do you plan on opening those facilities?
Jay, the pools are open. The steam and saunas are closed, and that's in terms of specific legislation. So, yeah, we until that is changed, that's the status.
Same with us. Yeah.
Great, thanks. And that's all the Q&A that's come through for us. Right now, our awesome team behind the scenes have selected 5 lucky winners who will each be walking away this evening with a voucher worth 1,000 Rand from Sportsman's Warehouse. So if we could bring up those names, Sfiso. Great, and the winners are... The first winner is Jacob or Jacob Rousseau. Congratulations. Our second winner is Patricia Goldblatt. Well done, Patricia. Our third winner, Rudzani Matodzi. Well done. Our next winner is Nzingizi Magadlela. Well done to you. Nearly caught me with that one. Wilhelmina Broodryk. Well done, guys. We will get in touch over email, and you'll have your vouchers emailed to you. So thank you for joining us tonight. So just before we wrap up, everyone, remember about our special gym offer. Gym now and only pay in 2022. So you don't need to wait for the new year to start getting active. Join the gym with Vitality today. You'll pay no activation fee, no monthly fees for 3 months, and you'll get up to 75% on your gym fees back in 2022. So that's all the time we have for today. Thank you so much to Prof, to Mark, and to Meneer, and of course, Dr. Mabunda. Thank you guys for joining us this evening and sharing your knowledge with us. It's been so valuable and inspiring and motivational. To you guys at home, please stay healthy, stay rewarded, and most of all, stay safe, look after each other. Have a fantastic night, and we'll see you again soon.